Good afternoon, everyone. I'm going to go ahead and get started, although I think we may have a few more people rolling in. Welcome today to this panel that we're holding related to, hosting many of our alumni for the Master of Science in Global Health program. Before I get started, I just want to remind everyone that we'd love to hear from you and hear your questions when the time comes during the panel. There is a Q&A button down at the bottom or on your screen. So feel free to put any questions that you have there and I'll monitor that as we get further along in the panel. We're going to start by doing some introductions. I'll just introduce myself and the master's program for a moment, and then I'll let my panelists introduce themselves. And then while this panel is titled From Global Health Masters to Medical School and Beyond, we'll be speaking, of course, with alums who are going to medical school, those who decided to go down a different route or path. But I do want everyone to know that we're talking about lots of other advanced degrees and clinical degrees, not just in medicine. So if people have questions that might be related to other potential avenues afterwards, just feel free to ask. And I'm sure that our panelists have had a lot of thoughts about different avenues to pursue, and I'm happy to answer those as well. So just to start, my name is Madhavi Dandu. I'm the program director for the Masters in Global Health. For those who signed on, you probably already know, but just briefly, we're a 1 year, really 10 and a half month, very quick Master of Science program that is meant to cover the breadth and some depth in really important topics that relate to global health practice and global health research. So we cover everything from foundational concepts like communicable and non-communicable diseases, health systems, and health policy, to disease-specific and illness-specific constructs like communicable and non-communicable diseases, and also think about different methodologies that you might use either in research or in practice, such as qualitative or quantitative research methods. And there's much more on the website, so you'll get a chance to take a look at that if you want to look at the curriculum. One of our key elements is our capstone project. The capstone is an opportunity to enact a research project. Research is very broadly defined in our context. Over the course of 10 weeks during the spring and early summer, though our students spend the entire year kind of creating the proposal for that project, and then of course analyzing and writing it up when they're done. And then finally, with regards to the types of students that come to our program and are interested, we're really open to and interested in having people with lots of diverse backgrounds, and we mean diverse in every sense. People come in with degrees in different disciplines, from different countries, from different ethnic and racial backgrounds, with very broad interests in terms of what kind of work they're passionate about in global health. So that's the framing. And I'm going to go ahead and move on now and ask our panelists to introduce themselves. I'm just going to go on the order in my screen. They're going to tell you a little bit about who they are, what they're doing now, and a little bit about their time in the program. Brianna, I have you first.
Hi, good afternoon, everyone. So my name is Brianna Vargas. I was in the program in the cohort for 2017-2018. And I am currently working on a variety of different projects. I'm currently serving as a full spectrum birth doula. Just got certified in January, so working directly with birthing folks in their reproductive health journeys. And I'm also still on NAMI California, so the National Alliance on Mental Illness, still on with them as a trainer part-time. So I'm doing some state trainings, getting some folks in San Bernardino County trained up in Mental Health 101. And I'm actually going to be starting a doctoral program in the fall at UC San Diego. The program is Psychological Medical Anthropology, so I'm super excited for that. But yeah, that's just a little bit of my background, and I look forward to getting more into it in a bit.
Thank you, Brianna. Camilla.
Hi, good afternoon. My name is Camila Hurtado. I was in the same cohort as Bree, and really loved my time there. And I find that it's really has gotten me to where I am now. And so now I'm in the UCSF UC Berkeley Joint Medical Program. I'm also really interested or really active in a few student groups. So I helped start one of the chapters here at UCSF UC Berkeley called the White Coats for Black Lives. And then I'm also involved in the Latino Medical Student Association as the National Policy Co-Chair. Yeah.
Thank you, Camila. Riseko, Ro?
Hi everyone, thanks Madhvi. My name is Resejo Bogete. I also go by Ro, which is R-O, so feel free to call me Ro anytime. I also graduated in 2018. I am now a clinical trial manager associate at Gilead Sciences, and I'm working in oncology. And I guess you guys will know about, I'll tell you more about this, but before I started at Gilead, I was heavy on communicable diseases. And I definitely believe that the master's program opened my eyes to things outside of communicable diseases, which is hence, how I ended up in oncology. But that's a little bit about me. Welcome to the panel today, and please ask us questions.
Thank you, Ro. Jeffrey?
Hello, everyone. My name is Jeffrey Azenia. I'm also part of the 2017-2018 cohort. So there's a lot of us repped here. I'm currently a first year medical student at UC Earthside. I think during the program, I became really interested in the intersection of the built environment and obesity. And after that, I worked as a clinical research coordinator at Stanford, doing something similar, looking at childhood obesity. Currently in medical school, I'm still kind of interested in that, and I'm still continuing to do research with my mentor from Stanford. So I think that is what I got from the program.
Thank you. And I'm honestly going to say we don't have a particular bias only towards that graduating class. So we do have Natasha here to introduce herself as well.
Hi, everyone. It's so nice to see everyone. I'm Natasha. I was part of the 2015-2016 cohort, so a couple of years before the rest. I went to medical school at the University of Illinois, Chicago campus, and I actually just graduated. So I'll be starting my residency in internal medicine and global health at Stanford in about 3 weeks. So I'm super excited for that. We'll talk a little bit more about it, but the master's program was a very large part of how I ended up choosing the medical school I did and then the residency that I did. And I'm planning on continuing my work in global health throughout the rest of my career.
Thank you, everyone, for the introductions. And Natasha, your comment just it pushes off the very first question, which is just, what was your career goal, or what did you think it might be when you entered the program? And did that change over the program? And if so, kind of how? So anyone can start. Feel free to just jump right in. I'm also happy to call on anyone if you want.
I can. Oh.
Go ahead, Brianna.
No, please.
Okay, I can definitely say when I started at GHS, I was 100% on the medical school route. That was like, no one was going to change my mind. I know what I wanted to do. I don't think I was forced. I don't think, even now, I feel like if I had gone that route, I don't necessarily think I wouldn't have been happy. But I always told myself I'm open to other things, but I don't think I was. I definitely wasn't. And so I did not figure it out while I was in the program. I only figured it out a year later when I, realized, okay, Ro, what is it that you want? Why are you doing what you're doing? Are you doing it because people are expecting it? And that was my reason. It wasn't that I didn't love medicine. I still do. But my major reason was, the only reason I was still on my route to medical school was because I wanted to live to other people's expectations. So for me, when I realized that, I was like, okay, now let's for real see what else is out there.
Thank you, Ro. Brianna, you want to chime in since you're about to do the same, I think?
Yes, yeah. So I think I came in, I'm pretty much doing the same thing. I knew that I wanted to focus on maternal and child health, but it was very general. It was just very vague. Like, I just wanted to work in that space, but I didn't really know to what capacity. And the program really helped to kind of narrow in my focuses on a variety of levels. So once I went and did my capstone research in Peru, that in itself was incredible. I think the capstone is what I was seeking. I applied to some other master's programs, but none of them had such an immersive component where I could actually go immerse myself in a community, do the work, get to know what it was going to take to be culturally appropriate, to be really like starting from the ground up and not going in with our own perspectives, but really like just seeking from the community, like what are the needs here? What is the perspective from this point of view? But yeah, so that really helped to kind of narrow it in. And so now my focus is definitely maternal and child health with a perspective on mental health. So discussing trauma, the medicalization of childbirth, what that looks like and how it impacts folks, not just here, but like in Latin American countries in general. I'm Latina, so I really wanted to kind of come from that cultural perspective and see what kind of determinants were making impacts in that arena. But yeah, it really helped me to narrow it in. The network that I built in maternal and child health was incredible. I, got mentors and colleagues and folks that were working in perinatal care, preterm birth initiative, and just to kind of have that exposure, and it opened my eyes to what was actually possible within the realm of maternal and child health. So I think that was one of the things I was most appreciative of. And yeah, now I know more specifically what I want. And, it's an upcoming question, so we'll get into this later, but the coursework itself also helped to narrow in, like, what is it that I actually want to do when I get into the arena of state and national policy making, or like program determination when it comes to maternal and child health.
Thank you, Brianna. I definitely want to hear from Camila, Jeffrey, and Natasha, but I'm going to add a part of another question for you because I still want to know what your career goal it was when you first came in, but also since you are in medical school or slash finishing up, slash just graduated. So do you feel like how did the master's program experience prepare you for the medical school part or the application, and kind of what was your timeline afterwards for applying to medical school? Some people take a little time, some do it right away. So I know that's a lot of different questions, but if you can kind of think about what you were thinking about when you started and kind of what happened afterwards and in the time in medical school, that would be helpful too.
So I think I came into undergrad as a pre-med because I didn't really know what I wanted to do, and that was kind of like a big option. I went to UCLA for undergrad, and there's so many pre-meds there. So I kind of got sucked into that. I actually hated it, to be frank. I hated being pre-med. And towards the end of undergrad, thought I wanted to do something different with my career, but I was part of a global medicine group and kind of realized I loved that. And that's why I ended up applying to the master's. So by the time I started doing the master's, I actually thought I was going to go a different direction. I wanted to go into the nonprofit world, maybe policy. And I was planning on using my time in the program to figure out what that career option was going to look like for me. Throughout the master's program, I think a couple people have already talked about this, but the mentors that I found there, I got to see what a lot of them were doing. And I kind of found myself thinking like, hey, I want to do what Madhvi's doing. I want to do what Vivek and Christina are doing. And I just chatted with them throughout that year about what, like, do you think I could go to med school? Do you think that's like what I should do to get to where you're going? And they did it. So I was like, all right, let me think about this seriously again. And I kind of came back to it with a fresh lens of like, these are my people. The global health people are my people. They're not no shade, but they're not like the other pre-meds that I knew at UCLA. Like, I really bonded with these people. And I thought if I could find a home here, I would love to be a doctor. And so I ended up taking another year after because I needed to actually like apply to med school. I was a course assistant for the program for that year. So just being in that environment, and there were a few of us that were applying all around the same time, just having that community was awesome. And then I ended up going to med school that following year. So I started in 2017. Yeah, so I think it was kind of a up and down path for me to get there, but the time in the program made me realize a little bit more specifically what I wanted my niche in medicine to look like. And after that, I kind of figured out that a little bit, it was a lot easier for me to come up with a plan moving forward. And then everybody in the global health sciences department was on board to help me figure out how to get to that next step.
Natasha, did you feel like there were experiences in the program that prepared you for your time in medical school?
Absolutely. And actually, one of my really good friends, Knox, he was in medical school and was on a year off while he came and did the master's. So we were in the same class. And I remember sitting and talking to him while we were studying about what the coursework was between the master's and medical school. And there were honestly times where he was like, this is a lot more work than med school. So if you can handle this, like, you're going to be fine in med school. So just from like a time efficiency and studying perspective, like, absolutely. But I think also I realized and this was probably the first time in all of my education I realized when I actually enjoy learning something, I can spend hours doing it. And so just being able to learn about like infectious diseases, the social determinants of health, I got my taste of that in grad school, and then went to med school, and then on my downtime would read more about it just to keep myself going, because I knew those are the things that I really cared about and I loved learning about. I helped build that into some of my medical school curriculum so other people could learn about it too. And I think that kind of interest all started in the master's program. So from a studying perspective to like what I actually like learning about and tailoring my medical school education, the roots were all there from what I learned in the master's program.
Thank you, Natasha. Jeffrey, Camilla?
I can go first, Camilla. I think for me, when I started off in the program, I knew I was kind of interested in medicine, global health, and like public policy, and I just did not know how to kind of make those things intersect, and I didn't really know how to go about it. So I think what I really gained from the program was just like great mentors. I worked with Dr. Laura Schmidt, who's just like incredible like policy brain, just it's like a phenomenal mentor. And I also worked with Dr. Anisha Patel, who is just like kind of works in like public policy as well as like research. So I think when I actually started off thinking about like communicable diseases and like water. And I think as the program went on, I just found out I was like a lot more interested in the built environment, obesity, and kind of how those things intersect to put communities, especially communities of color, at risk of getting like obesity and getting all the comorbidities that come with it. So I think that is what I personally gained from the program. I had a little bit of a weirder path. I took 2 years off before going to med school. In those years, I worked with one of my mentor. I went down to Stanford University, and I was working with her on her research and as a clinical research coordinator. So I stayed there for a couple of years. And in terms of Madhvi's questions, I think what I gained from the program when I started applying to medical school was just time efficiency, just how to be efficient with my time. Because as you guys will find out, like it's a lot to get your master's in like 10 and a half months. It's just a lot squeezed in a very short time. And I think during that program, I just kind of learned how to manage my time a little better, how to study smarter. And I think I just also learned how to learn to love to learn. And I don't know if I'm saying that right, but I think that was a huge aspect of the program that I really like loved. I think I'm good.
Yeah, I think I'm just going to be echoing Jeffrey and Natasha, because I was on the pre-med track before coming into global health, but I think global health really helped me really decide that this is the right thing for me. And I think part of that was taking the economics class and the health systems class and the policy class, because that's when I really realized that I could use an MD degree in all of these other ways as well. And so that for me was really the deciding factor in terms of like, okay, well, if I want to go into medicine, like this is why like it's more of like advocating for patients and for people like my family. And so it was like, it's I think that is what touched most, or what kept me going in the medical school application process, and continues to guide me now. But it was definitely, it took time. I think I applied the year following graduating, and during that time I was working at La Maestra Community Health Centers in San Diego as a quality improvement specialist, and then from there entered and matriculated into medical school.
Thank you all so much. I have more questions, but actually because there are a couple of questions in the chat, I'm going to take those first, because I think let's entertain what people are wondering about. One question is, how competitive were your applications for this program? And I know that probably affects a little bit about, well, I shouldn't assume, but one question that often comes up is that, if people are thinking about another degree afterwards, medical degree, advanced PhD, or other degree, did they already come into our program with everything they needed to go into the advanced degree or not? So I think that's a little bit of where this question is leading, but maybe just specifically, how competitive were your applications for this program is the question. If you feel comfortable sharing.
I can start this one off. I think I don't know what Madhvi would say, but I think my application was I think it was fairly competitive. There were definitely parts of my application where I'm like, if they see this, it's over. It's over for me. But just so you know, my GPA coming out of undergrad was 3.6, and this program, the 3.7, sorry, this program it didn't need a GRE or a GMAT, but they said that if you have taken it, submit your scores. I was panicking, everyone. I was like, God, if they accept me based on this GRE score, there's no way I'm getting in. And I'm so happy that they, that wasn't a huge part of my application, because I wouldn't be here with you guys. I wouldn't be where I am. So I think your application is whole. Yes, there's specific parts where you want to make sure that you're putting your best foot forward, but don't not apply. Don't be the one saying no to yourself. If they're gonna say no, then that's fine. But then if you're blocking yourself, if I had blocked myself from that GRE score, I don't know. I'm like literally shaking coming to thinking of not being in this program. So yes, it's good to have a competitive application, but it's not an end all be all. Apply.
I should just interject and say that we have a completely holistic review process. Our candidates, our students, people who decide to come to the program, the ones we accept, and then all the ones who decide to come to the program, we look at applications incredibly broadly. Not like there are some elements of a academic portion of an application, like a GPA, that can guide us in certain things. For example, because of the incredibly fast-paced nature of the program, and because there's a lot of technical content. So if someone has had really big struggles in math classes or statistics classes, it doesn't mean that you can't get into the program. It means that we need to look and say, you know what, this is the kind of preparation that you need to do beforehand, or this could end up being a struggle for you. What resources will you look for or bring into the program that we can also supplement to help you? But and then, we need it to be a good fit to make sure that people feel ready and are prepared. So are there times where we might suggest, you might benefit for doing XYZ before you come? Sure. But just to be really clear, we review applications completely holistically, and while grades and scores can be part of that, it's certainly not in any way all of it. Brianna, were you going to add something to that?
Yes, actually, and it just builds off of that. Sorry, there's like background noise. I'm outside, as you can all tell. So I wanted to add that I feel like what Madhavi is saying is absolutely correct. I think because I'm like proof of that. So I graduated undergrad. I'm just going to be totally transparent here, with a 2.5. I was a first generation student. It was not an easy time. I was dealing with a lot of personal issues and kind of trying to navigate everything on my own. And UCSF was not on my radar yet, but I started to talk to USC, their program down there in global medicine. And they recommended, you should probably, retake some courses. So I did that. I went back to community college. I retook all of my science prerequisites and excelled there. Got a 4.0, retaking the prerequisites at community college. And then UCSF popped onto my radar, and I was leaning more heavily toward this program. Like I said, for a variety of reasons. There was a lot of folks that I had already read, some publications that I knew were faculty. It was exciting, and then the capstone as well. So I did that, and I didn't know. I was like, you know what, like this might not work. They might still see that tarnished GPA and say, maybe not. But I do remember that the interview process was kind of where I was able to show my progress and what I had done on this journey, and why I thought that I was now ready to be a competitive applicant for the program. And it worked out, which is great. But yeah, I just have to echo what Rose said, like, don't make the decision for the program. Put yourself out there, just put your best foot forward. But I definitely think, if you think there are parts of your application that you would want to strengthen before feeling really good about applying, I always think that that's a really good route to go.
Thank you both so much. And I just wanted to note that we don't always do interviews now. We have specific reasons that we do interviews that are listed on our website, including some of our international candidates and for people who have had lower GPAs, so that we can ask the questions that Brianna was talking about. But there's a space for everybody in the application and the written portion of the applications to talk about their own growth. I mean, our expectation in global health is that people are going to be challenged with something new. We always will be and always are. So what matters most is how people handle or have learned to learn and how to handle new situations, because that's really one of the most important aspects of responding to situations that are unexpected. There's another question from Ashley where she asks, do most people go into medical school after the program? What path do people take who are not interested in medical school? I'll let people pop in from what they know from their classmates and colleagues or themselves, but I'm also happy to add a little afterward as well.
Can I add a little bit to the previous question?
Well, please, I should have asked you to do that, yeah.
Yeah, I was going to just say, you also have to keep in mind you're here to learn. So I think if you have a passion for this and you think you should apply, I think you should go for it. I think when I came in, like, I didn't have any experience in like biostats or like epidemiology, and I was like, oh man, that's gonna make, and that's like the entire first quarter. There's so many of those classes. I'm like, oh man, this is gonna like ruin my application. And I think during the program, I actually learned that I love those things, and just because I had a passion for global health, and like, those things were able to shine through in my application. So I think even if you don't have like the best GPA or like, you don't have the most experience, I think, you should look at yourself holistically. And if you have an interest in global health, I think you should.
Thank you. I'm going to just make a comment and then you all can add on about the question of most people go to medical school. So the answer is no. Many people go on to get advanced degrees after our program. I would say over a half, and that probably eventually, not necessarily in the year or two after they finish, it could be many years after. And that varies a lot. Like Brianna, sorry about all the noises in my background, but I think we're all used to that now too. But that varies. Of the portion of people who go on to get advanced degrees, the majority are in medicine. I would say over half, but we have people who go on to get nursing degrees, pharmacist degrees, dentistry degrees, PAs, and then physician assistants. And then there are many who go on to get different kinds of PhDs or doctorate, DRPHs or other advanced degrees. And I would say that that's about a half, at least, of the people that go on. The other half, some people come in with advanced degrees, and so that's just a few people, but there are many others who go on to do practice in global health. And what that means really varies. It could be being on location in a resource-constrained setting in the United States or otherwise, working with community organizations, nonprofit organizations, governmental organizations. We've had students go on, to work with federal organizations in the United States, departments of public health. And then I would just say that, we have 13 years of experience now, and just, that careers are long. So we anticipate, people go through different stages and work with different kinds of organizations after. So certainly you will have people that do all different kinds of degrees. But as a caveat, I will just say that we are a health sciences institution. So the mentors will work with, most of them have either PhDs or clinical degrees. Not every single one, but most will. So you will have that bias. Oh, sorry. I should say those are the faculty in the program will have those degrees. Now, some mentors are very different, broadly speaking. That people who mentor your capstone projects can have much more diverse backgrounds in terms of degrees. But because that's a lot of what you're exposed to, you may not get to, for example, have a birth doula necessarily teach your women's health and empowerment class, but you may get exposed through the work you're doing, for example. So if you're really interested in that, it might be slightly harder. You might have to take extra steps to find those mentors, or we would help you. But so there is that bias in the people you're exposed to because we're at UCSF and a health sciences institution. Anyone want to add to that?
add a little bit to that because I did not go to medical school. So just to kind of explain what I do, I work for Gilead Sciences, which is a pharmacology company. It's a pharmaceutical company, and we develop therapies for a various number of diseases. So we work in HIV, liver diseases, hepatitis, inflammation, and I'm sure there's some that I'm hematology, but right now I am in, and for a long time, I'm in oncology. So before and after the program, I never knew my job existed or the field existed. And the field is clinical operations. I didn't know that was a thing. And of course, then that wasn't my interest. And so after the program, after studying for the MCAT, after realizing I'm not going to medical school, I sat down and I talked to a lot of colleagues and, went around and I was like, okay, what are you doing? What do you think are other health science avenues? Because I definitely wanted to be in health. There's no, that was done. There was no people. I mean, I changed my mind on going to med school, but I was definitely not changing my mind on being interested in health. And so as I did that, it was very scary. It was very scary because as a student, you're comfortable being a student. Yes, you're not employed, but you're a student. At that point, I was now unemployed, did not have any, I didn't have, like, oh, I'm aiming to go to this company. I didn't have anything solid. So that talking to people and like doing my research online really helped. And that's how I stumbled upon clinical operations. And the more I read on it, I was like, oh my, I actually want to go to schools and teach and like have presentations and be like, this exists, guys. Clinical operations exist. So I think even if you apply to this program and you don't know what you don't want to go to med school, but you don't know what you want to do, don't let that stop you, because being in the program will definitely open your eyes to what's there, and it'll also open your eyes to other people so that other people can open your eyes to what's there. It's not a linear path, and there's a lot of growth. There's a lot of growth externally and internally, and it's continuous. So I hope that answered a little bit of the question of what path if not going to med school.
Thank you for that.
And
sorry, Natasha, go ahead.
Ro, that made me think too that I think because of where we are in San Francisco in the Bay Area, one thing that I hadn't thought of that one of my best friends from the program, Shabani, ended up doing was working for Facebook after she graduated. And a lot of the tech companies have global health or just global initiatives that they need someone with the skill set that we come from. So they may not be interested in like the same kind of work that we do in the master's program coming from an academic university, but the skill set that they need to be able to run their operations for whatever they're trying to do are similar. So Shabani worked at Facebook for a little bit. I just, because I'm coming back to the Bay Area, I'm thinking about how I can collaborate with the tech giants in the area too. So that's also another really unique opportunity that I didn't even know existed until I was in the program.
Thank you. There's another question, this one probably best for Camila, Jeffrey, and Natasha, about do you think, does having the Global Health Master's degree help you be more competitive in terms of your medical school application? And you could talk a little bit about your experience or anything that you've heard from classmates or colleagues.
I can start. I don't have any formed thoughts, so it'll be stream of consciousness. I think it's really interesting. So, going back to grades, I didn't have the highest GPA at all coming out of undergrad. And so I did get questions during my interview process. Did you do this master's to complement or to compensate for your GPA? And honestly, when it comes to that, just technical, like you only have a few classes. By the time you reach, that part, your GPA is already pretty set, and you only have a few classes from this master's program that are going to apply to that GPA, like the sciences, biology, physics GPA. So it doesn't really have a huge effect, but what it does do, I think, is really broaden. It rounds you out as an applicant. And because I was so incredibly passionate and still am about global health, it really transmitted through my interviews in terms of what I want to do and why I want to do it. And so that is what I mostly focused on. when it came to talking about my interviews or talking about this program in my interviews is like really passionate about health and specifically for like Latinx people in the US and like why, you know, health is the way it is in this country and what we can do about it. And so I think touching back on this program, it really helped me define that and understand like the broader systems that explain like health disparities in the US. So, and outside of the US. Yeah.
Yeah, I totally agree. I think in my medical school class, I think almost a third of people come in with a master's already. So it's not, I think it might have been one of those things where a while ago it was like you would stand out if you had another kind of degree before coming to med school. And I don't think that's really the case anymore. So it's more on the passion side of like, is this going to inform what you want to do with your career? And they want to bring in somebody that has a different kind of career interest and a different skill set. I think I also want to be clear, this is not a feeder program to UCSF Med School. So I think there are programs out there like postbaccs or other kinds of masters where they do guarantee interviews at the medical school if you participate in the program. This is not a feeder program to UCSF. And I just want to be clear about that too.
Thank you for saying that, Natasha. I think that's really important because just to be frank, it's a very time-consuming, expensive step forward if that's the main goal. I think what both Natasha and I know that's not really what the person asking the question was saying, but I think it's just really important to be clear that there's medical school application processes are super competitive, and you know this program probably can help you in defining your interests, because the more clear you are about that, the better that process goes. But probably not necessarily. I mean, it can show growth in terms of your skill sets too, if you struggled academically or were challenged by certain things. But Jeffrey, I think you were going to say something, so I'll let you continue first.
Yeah, kind of going off what everyone else was saying. I think for me, I'm not sure if it makes you more competitive when you're applying to medical school, but I think it does showcase a different aspect of maybe your interest. I think I was able to maybe talk a little bit more concretely of the things I was interested in. Like for one, I knew I was like interested in like childhood obesity, and I was kind of interested in policy. So during my interviews, I was able to talk like really strongly about that and show kind of the work I had done in that and the mentors I had in that field. And I think that maybe helped make me a little bit more competitive as an applicant, but I think it is also what you make of it too. I think the program just gives you a lot of opportunities to like network and to meet like, incredible mentors. So I think you can make of it as you want, but I don't think it is like, if you go to those programs, like guaranteed you're going to go into like UCSF or med school or whatever, but I think it is what you make of it.
Thank you. And the next question from the audience is, why did you choose this program and not something like public health? Brianna, I know you. Sorry, go ahead, Jeff.
I think I could start off a little bit. I think coming into the program, I was interested in working abroad, which I think is kind of ironic because I ended up doing my project in San Francisco. But I think that's maybe why I chose the program, was because I knew I had an interest in global health. And I think also during the program, it is kind of an understanding that, you know, kind of like it's cliched, but the global is local. And I think I was able to kind of see how my communities in like San Francisco and Oakland, how that was intersecting with, you know, the built environment and how that was impacting their health. And so I think it was able to help me make those connections. So I think even if I didn't end up doing something global, I think it was still able to kind of scratch that itch that I had to kind of understand why certain communities are becoming more disadvantaged and getting all these health disparities.
Yeah, I can kind of bouncing off of that. So my focus for the upcoming doctoral program is really trying to understand here now, interestingly enough, right, more locally, the impacts of racism on childbirth experiences. It's just like specifically for BIPOC folks in general. So Black, Indigenous, people of color, communities. And I think what ended up happening in the process of this master's is that that's what I was seeking. I wanted to know, like, is this happening in other places, or like what's going on here, like the dynamic between like provider and patient, structural issues, social determinants of health in this country. So I was really intrigued to understand the birthing experiences in other places, specifically Latin America. I ended up doing my project in Peru because I think it's important. And it gave me that perspective of, seeing the larger picture. And it's actually helped me to narrow in my question now here to kind of better understand how policies, how the political climate, how structural issues here and things like racism in America actually influence these things. So I wanted that larger perspective, and I definitely feel like I got it. And it's just like everyone has been mentioning, it's like the mentorship that comes from it. Like folks are working everywhere. They might have projects in Latin America, but my mentor, Dr. Holly Martin, she's a pediatrician at UCSF. So she's still, back and forth working on projects in Peru, but also working on maternal and child health here, specifically in the Bay Area. So these are conversations that are starting to come up. So I think just to be in that space and to see how the questions are evolving and forming based on the climate of our local issues, and then also like what's going on in the world around us.
I think there's like a decent amount of overlap too, because with MPH, the curricula across different programs is pretty set in a lot of ways. I've been asked a lot through med school if I would consider going back and doing an MPH, and then I explain like these are the skills that I picked up in my master's. And I've actually asked people too, like, do you think it's worth it for me to go back and do an MPH for the degree? Because what I want to do in the future, a lot of people have an MPH, and it's kind of a weird thing with the titles and degrees. But once I explain what I've learned and what I was doing in grad school, then people are like, there's enough overlap here where we're confident you have the skill set to be able to hold this position or to weigh in on these kinds of, this project that we're working on. So I think there is a decent amount of overlap, but similar to them, I really just wanted that skill set, but be able to practice it in a global context. And a lot of the MPH programs that I had looked at had like a class or a semester on global health, like adapting this framework of thinking to other countries and other settings. But I really just wanted to be able to practice that throughout the entire master's. But in talking to people over the last 4 years in med school and a lot of my mentors, I think there's a lot of overlap where I'm not like barred from any positions or any kind of involvement in things just because I don't have an MPH.
Just to add on, there are a couple of small practical reasons one might compare an MPH and MS program for themselves. So one situation in which having a master's in public health can be advantageous is if you are really clear that you might want to work within a state or county health department immediately. Now, many of our students actually collaborate and end up working in these in departments of public health, and we actually have many that are there. And especially this year with COVID, we had so many people crossing between different departments of public health. But it is easier to directly go into that or have a mentor there or something like that if you are saying, I'm going to work for the California Department of Public Health, for example. Now, so that's one thing. And then practically speaking, some people also consider timing. So if you do not have an advanced degree, you have MPH programs require 2 years. And if you already have an advanced degree, you can do the MPH program in a year. So that's another, those are just a couple small practical things people might consider as well as they're thinking through the process. And yeah, I think I've sort of said this, and I think you would all agree that really what's really important to us from the master's program is just that the fit is right. I think I've said to many people over the years that, I think we have a fantastic program. However, there are many great programs out there. I don't really think it's important to ever say like, oh, this is the best program that, I think it's an awesome program, but it's also an awesome program for the people for whom it's the right fit. And so, you have to want to be in a health sciences program. You have to want to do it in a really fast paced process. You have to want to, be connected to, we might not have expertise in, I'm trying to think of a topic, blank topic, I'll try to think of one, as well as maybe a different program that happens to have the world expert on that topic. So if that's really something that you're drawn to, you should always take those things into account when you're making your decisions. However, from a practical standpoint, in terms of both public health and global health, think about what the skills are that you're trying to gain. And so if you said to me, I know I love biostatistics and I need to take like 4 or 5 advanced classes in, or let's say epidemiology, and I need to take several classes in epidemiology to feel like I have that content expertise, then, you know, our program doesn't have that as an opportunity for you. We really only have 1 class in epi, and, you know, you could do your master's capstone project with an epi focus, and you will get a lot of skills. So like Natasha said, she doesn't really necessarily need the MPH to then go on to do epi work. But if you're going to try to really do epidemiology and then teach as an epidemiologist, you know, it makes sense for you to say, okay, I need to focus on that, or go on, if you're going to teach often, you'll go on for a PhD in epidemiology, right? So there are specific reasons, you know, like our classes are not, should I say not flexible, meaning that we have 1 elective, but everybody takes all the same classes. So if you said, I really wish I could take this elective and that elective and this elective, we don't have that opportunity in the program. Not because we don't think it's a great idea, but it's just too short. The program's too short. So I think you have to look into a lot of those practical things as well when you're thinking about what program is a good fit for you. Are we the right fit for what you think you might be interested in? And that's sometimes a hard question. So we're always happy to, you know, connect you with alums who might be doing things, or just speak with you about what your particular situation as well. All right, I'm going to ask one additional, I see more Q&A coming in. So I'm going to go ahead and ask those questions instead of asking the ones that I had prepared, because I think that's probably most important. There's a question that says, with the current situation surrounding COVID, how do you feel global health research is being impacted? Are there opportunities for new students to conduct research abroad being limited? I'm going to start with the answer to that question, and then have other people comment, because all of you have been doing ongoing global health. Some of you have been doing ongoing global health work and have probably been impacted. So the answer is, are things limited? 100% yes. So for this year, for example, none of our students could travel for their capstone projects in terms of the travel portion of the work and being physically in the location. In fact, whether it was abroad or domestically, most people couldn't be on site. Now, that was also true for our colleagues and researchers. So that means, you know, our mentors. So that means people were none of my colleagues and myself, we couldn't go abroad to do our work either. So that is the case. In terms of the upcoming year, I have a strong feeling that a lot of things are going to open up again. But remember, there's just first, there's a lot of unknown, but there's also just a huge number of disparities in terms of vaccine distribution, vaccine access, healthcare access, et cetera. So maybe certain countries would open up, maybe certain spaces will open up and others won't. And we're guided entirely by a combination of the policies and the laws, but also the kind of equity questions that come in to whether or not it makes sense to bring another human being into a space that has resource constraints in the time of a pandemic. So it's something that we've been thinking a lot about. That said, I think all of our students can attest to the fact that the impact of work, that physically being in a place can be really meaningful for learning, and I don't want to devalue that. However, there are also potential risks and harms and other things that happen in the setting that you're in when someone is in that setting without a lot of experience. So we always try to balance the ability to have impact even without being physically present. So can you do work over Zoom, or work, interviews in a different way? Can you do analyses from a distance, et cetera? I think that is something that we really think about and value, and also re-highlight the importance of domestic and international, domestic work being as valuable. And then, sorry, I'll just add one last thing, which is that, we in global health are having a really important conversation about the way work should be done in the future, and in this concept of decolonization. And I don't know whether, global health work will always be done the way it is, of us going to some other place to do that work. In fact, it probably won't be, and it shouldn't be. However, learners going from place to place as a learner is something that hopefully we'll always be able to have, because we can go into those settings and gain a lot from the exposures that we have. So that's a really long-winded answer to this question. I think things are changing a lot. And will change. I don't have a perfect answer to the question of whether or not this next cohort will be able to travel. Our goal is yes, but obviously will depend a lot on the pandemic and equity questions. Okay. I did say that I was going to ask if anyone wanted to add anything, but I think I will ask instead one kind of last question. And in this question, I'm just curious, and I think people would love to hear how you think that global health might play a role in your future career.
I can start because I think mine's like really tangible. So I chose my residency program because they're one of two internal medicine programs that it's kind of like a separate residency for people who are interested in global health and internal medicine, where rather than having like a special track through my residency, they actually bargained with our accredited body to get special time and funding for me to do global health work specifically. So I, throughout medical school, realized it just kind of kept affirming that this is what I want to do with my career. So I chose my residency based off of that. I chose the mentors that I'm going to be working with based off of that. And yeah, I just, you know, basically that is because of the growing interest I had through the master's program and those mentors. I've stayed in touch with a lot of them like throughout med school, and I know I will keep being in touch with them. I'm still working with some of them on research. So yeah, this has absolutely defined what I'm doing with my career.
I can just say something really quickly, just kind of building off of what Natasha said. The reason I selected the program that I'm attending in the fall is actually because of that. So I knew that I wanted to still have that global focus, even though ultimately, and I mean, we'll see what happens in the program itself, but ultimately I would like to kind of stay in the local area and see how communities are affected here. But the program at UC San Diego has a global center for mental health. And so just, again, like I mentioned, like that's just something that appeals to me, is kind of understanding how other folks are handling it, how other folks are approaching it. That's always kind of been one of my goals, is to learn those different approaches. It's what sparked my interest in global health in general. I took a medical anthropology course in undergraduate, in my undergraduate studies, and learned about how Italy like completely transformed their mental health system and turned it into like very community healing, and just like completely transformed how they do the work that they do. And so I think in that sense, I know that even if I do end up staying here and working with immigrant communities or BIPOC communities, that perspective, I think, will always help to kind of keep me grounded. And this program, you know, goes into a lot of those difficult conversations about decolonization and what this is going to look like in the future. And I think staying grounded in that, whatever route that you go in, will keep you connected to the community and to the work itself.
I do see one more question, so I just want to go ahead and take this question before we close up. The question, and I'll ask you all to chime in, but I do want to say one thing, which is, the question was, can you share your experience in the program related to environmental or planetary health and human health, sort of the intersection, for example, resource management, agriculture, waterborne or vector-borne disease? I don't know if someone wants to answer for one moment, and then I have a thought to add too.
I was just thinking of Knox's capstone, which is the impact of climate change on malaria rates in sub-Saharan Africa. We had someone else in my class, and I can't remember exactly who it was, that looked at food accessibility and HIV rates and how agriculture was changing in that area and how that was affecting HIV rates. So from my experience, I think there's like a whole wealth of mentors who work on planetary health that you could work with for your capstone project.
Thank you, Natasha. I think that's exactly right, that the capstone is the place in which that intersectional work happens. So we've had people work on, for example, snake bites, both in animals and humans, and a lot of those things. I just always want to make sure we don't overpromise. So first I should just say this is a program that is an evolving program. The curriculum doesn't look the same now as it did 10 years ago or 12 years ago when we started. We've added many, many classes, changed electives over the years, and there's no doubt that global health's focus on the intersection of human and animal health, or on planetary health and climate change and everything, is definitely coming even more to the forefront. We should have been there, but it's more to the forefront now. And so the program has evolved in some ways to include more of that curriculum in our, for example, our NCD course, or in our policy course, or in our determinants of health courses. However, we do not have like a core course in that. And we've had some students over the years I've counseled. For example, we have 2 students now who have an incredible interest in that. One who probably will go on to vet school, and another one who's thinking about other degree work at the intersection of planetary health. And they both, I spoke with both of them before, and they have felt like it's a good fit. But there are other people I've talked to who've looked at other programs who wanted to make sure there was a broader, consistent approach to that through the entire curriculum, which we don't have as well. Okay, well, it's a minute or so before the end of the hour. So first of all, I just can't thank you all enough for joining us. You are all super busy and in the midst of a lot of other work. And so thank you so much for being here. And I'm so thrilled to see your faces again. And I really hope that one thing that didn't really come out of this conversation is that, and I think all of you would attest, that one of the other really amazing things about the program is the community, both classmates and just the even alum community as you connect with each other. So I'm so always happy to see you. For the folks that are joining us, thank you so much for joining. If you have other questions, you can always reach out through the education email address, which is on our website, to ask any questions. And if you have specific questions for alums, we're always happy to ask them to connect with you. Thank you for joining us.